Given that which we just heard from Professor Whitty, given the infection rates, given the hospitalisation rates, are you still comfortable with the great unlocking that is coming on Monday?
Well, you're right that infection rates are still rising, but the situation we're in at the moment is that around 80% of people have had their first vaccine and over 2/3 have had their second vaccine. And we know that we have weakened the link between the infection rates, the hospitalisations and deaths. And so now is a good time to loosen those restrictions, because if we don't do it now, when are we going to do it?
Well, perhaps in a few weeks' time, when more people have been vaccinated.
Well, we did wait. You will remember we were meant to be opening up on June the 21st, but the government made the decision to delay that to enable more people to be vaccinated. And we've beaten the target that we set for those second vaccinations by a week. And so now we are moving from legal restrictions to people taking personal responsibility. So when we are saying to people, do continue to be cautious, do take measures, but now we are just taking away those legal restrictions because of the success of the vaccine programme.
But let's just dwell just for a second on that which we heard from, none other than the Chief Medical Officer. Chris Whitty said this: I don't think we should underestimate the fact that we could get into trouble again surprisingly fast. Things could look a lot worse in 5, 6, 7, 8 weeks' time. That's the Chief Medical Officer saying, in essence, that in a little over a month we could see restrictions coming back in, isn't it?
Well, he did say that matters could escalate, and of course that is true. But he also said, let's look at where we have come from, and let's look at also that we're not in the same place that we were when restrictions first went in. We have the vaccination programme, we have the genomic sequencing to detect new strains, we have the test and trace system, we are fully stocked with PPE and all those other things that we just didn't have when restrictions came in place. And the key to all this has been the vaccination programme, because we know that you're much less likely to get a severe illness if you are double vaccinated.
Sure, but I'll repeat the question. Chris Whitty saying, in 5, 6, 7, 8 weeks' time, we may need to look at things again. That is the Chief Medical Officer saying that in England, in a little over a month, we could see a return to restrictions, isn't it?
Well, I think the Health Secretary has been very clear, as has the Prime Minister, that we will see infections rise. But the reason why the restrictions are being taken away is because of the vaccination programme, which will protect people when those infection rates do rise. And of course, if we get into a situation where it's unacceptable and we do need to put back further restrictions, then that, of course, is something the government will look at. But, we're going into the summer. A large number of people have been vaccinated. We've had a really tough time. We're still asking people to take responsibility. And we do need to ask ourselves, if we don't open up now, when will we be able to open up?
Yeah, as you say, Ms Fraser, we are asking people to exercise their own judgment. We're asking people to go slowly. But we've got 140,000 people pitching up at Silverstone this weekend.
Well, there are some large events, and of course there are measures in relation to those large events. But what I've seen over the course of the last year is people taking a huge amount of personal responsibility, not always just abiding by the rules, but going beyond the rules. I've seen people, outside wearing masks where they don't have to, and there are different restrictions in different places for different reasons, and of course the measures will be changing on next Monday.
I just wonder if we can dwell just for a moment on the COVID app. The NHS app pinged 520,194 people in the week leading up to July the 7th. That's not sustainable, is it? We're already beginning to see businesses complaining about the fact that production lines are, in essence, literally grinding to a halt.
Well, I understand people's frustration in relation to that, but we must remember it is an important tool, the self-isolation tool. But we have already announced, of course, that on August the 16th, again, the measures will change. And if you are fully vaccinated, you won't have to isolate, but instead take a test.
Sure, but that is a month away, and we're not yet even at, as ministers have stopped calling it, but they used to, Freedom Day. We're 4 days away from Monday. The only thing that is going to happen when we relax restrictions is that more people will be getting pinged. 500,000 in the week to July the 7th. One wonders what it's going to be in a couple of weeks' time, perhaps reaching into the millions.
Well, as I said, it is an important tool because it is important that you do isolate if you've come into contact. I know this is something the government is looking at. In addition to the changes in mid-August, the government is also carrying out a number of pilots to see whether instead of isolating once you get pinged, you could take a test. So the government is looking at this very, very carefully, recognising the significant impact that is having on businesses.
Medical experts in the British Medical Journal have been pretty scathing about the plans for July the 19th. They've claimed that the government's strategy of, as they describe it, infection over vaccination, unethical and unscientific. I just wonder if you have a response to the BMJ describing the government's strategy as, again, unethical and unscientific.
Well, the government acts basing its decisions, its political decisions, based on scientific evidence. And what it's seen in this period coming up to July the 19th is that although infection rates are rising, the link between infections, hospitalizations and death is weakening. So if I give you some recent statistics, we recently, I believe this is yesterday, but the numbers might be slightly off, we had around 40,000 infections. We had around 500 hospitalizations and around 50 deaths. So there is, of course, all those hospitalizations are of concern, and even more so the deaths. But there is a significant difference between the number of infections and the translation into hospitalizations and deaths.
Well, actually, I mean, you were correct. I mean, the figures have changed slightly from that. Rather than 40,000, it was almost 50,000 new cases yesterday, the highest since January the 15th. Rather than 500 hospital admissions, as you said, it was 621. We've got 3,241 beds occupied compared with 2,209 last Wednesday. Things are getting bad very, very quickly, as Chris Whitty said.
I don't think that the Health Secretary has suggested anything otherwise than the infection rate is going to rise. And as a consequence of the infection rate rising, that means, because there is a link between the two, that it follows that hospitalizations and deaths will rise as well. But there are also consequences to not opening up, real consequences, not just to people's jobs and the economy, but to mental health as well. Also to people who haven't been going to the doctor because they fear it. There is and so it is really important that we get the balance right between ensuring that we keep this virus under control and we take the necessary clinical measures to do that, but that we also recognise there are consequences of not opening up and not allowing people to go about their daily lives.
Ms Fraser, we do appreciate you taking so much time to speak on stuff that is technically away from your brief. I just wonder if we can move it slightly closer to it. The statute of limitations that is being introduced to deal with prosecutions relating to actions during the Troubles in Northern Ireland. All 5 political parties in Northern Ireland are opposed to this. The Irish government is opposed to this. Provisionals on both sides are opposed to this. Is it time for a rethink?
So the issue in relation to this is that as time moves on, the chances of getting successful convictions gets lower. And I know that this issue is causing a lot of issues in Ireland, and it is important that we engage on this subject. And the rifts are developing, and I know that the government is engaging with all parties. It will continue to do so before it brings forward any legislation.